Now, if you're listening to us, this is our first ever episode. We're doing this a little bit nervously, but I want to try and explain why we're doing this podcast. So from my point of view, we're two nurses. We've been nursing a decade. We've got a lot of experience and a lot of really unique experiences that I think people are interested in hearing. It's very rare that you get to see the point of view of someone's unfiltered, which is the tagline we're going with, and just, letting you know what it's really like on the field. We have a range of topics that I really want to get to. What is a nurse, the work-life balance, self-care, different types of pathways in nursing, Grey's Anatomy, all the TV shows, are they actually real? All this sort of stuff I feel like I want to get off my chest. And I didn't know of a better way to do it than starting a podcast with my beloved wife. Hi everyone, I'm Leon.
And I'm Nicole.
And this is Nursing a Couple. We are your two favourite unfiltered nurses.
We are scrubbed in, switched on, and ready to dive into this week's episode, which is all about us.
Nice.
We're just going to tell you guys a little bit about ourselves, introduce ourselves.
Talk about nursing a little bit.
Yeah.
So who should start? Do you want to go first?
Well, to kick things off, let's tell everyone what gives us the right to talk about nursing.
Yeah, that sounds good.
So, like I said, my name's Nicole. I am 31 years old and I have been nursing in some form or another for about 10 years, I'd say. I try not to make it my whole personality, but I do think that the drive to become a nurse comes from an intrinsic part of myself. I started out in oncology and hematology, and then I worked in NICU during my grad year. After this, I spent the probably next 6 or 7 years in the adult world. So I started in oncology and hematology, which is basically cancer and blood disorders. After that time, I moved into the pediatric world. So I started working with kids. My first job in the pediatric world was renal dialysis. And then I was pulled once more into the cancer sphere. My career has been very focused. That makes me a very experienced oncology and hematology nurse, a very experienced ward nurse.
Wow, so there's a lot of stuff you've just built out there. I just want to ask you a few follow-up questions. So you've done pediatrics and adult patients.
I sure have.
So which ones do you like more, pediatric patients or adult patients?
Definitely pediatrics, I think. I don't know if that is because that's where I work now, potentially, but I do really enjoy working with the kids and working with their families.
Yeah, right. I think I'm the opposite to you. Yeah, I'm the opposite.
You like your patients unconscious, don't you?
I love unconscious patients, yes. I love adult patients. You can talk to them, you can rationalize with them, but yeah, perhaps maybe that's a good segue. I should talk about my experience.
Absolutely.
Yeah, so just like similar to Nicole, I've been nursing for 10 years or so now, maybe a little bit more. Started out my journey as a scrub scout nurse, partially a perioperative nurse, which is the big umbrella term for theatre nursing. So started out in scrub scout, which is helping the surgeon mainly during procedures and operations.
So when he says scalpel,
here you go, to cut it when I give it to him. Yeah, so did that for 4 or 5 years, and then I thought I'd wanted a small change, and so I ended up applying for something called the T2P, which was a transition to perioperative to give you experience in other forms of theatre nursing. And then I went into anesthetics and recovery nursing. So anesthetic nursing is still in the operating room, though you're helping the anaesthetist, giving the patient drugs, helping them with airway, that sort of thing. And then on to recovery nursing, where procedure's finished, you wheel the patient out to recovery, and you wake them up after surgery, usually. So
it's your beautiful smiling face that people see when they wake up.
That's right, my beautiful smiling face. Oh my god, yeah, that's a compliment, isn't it? So that's generally my story. But coming back, as I said, I've only done adults, so I don't have much experience with pediatrics. Usually you have to go to another hospital, like a pediatric hospital, to do that. Just haven't been. So yeah, I think I still rather prefer adults rather than children. Yeah.
Fair enough. It definitely isn't everyone's cup of tea, but that's the beauty of nursing, right? There's so many avenues, so many choices.
Yes. And that's the same thing that you said, because you've been in pediatrics. Like, let's break it down. There's adults and then there's kids. You've done kids, but in kids you've done hematology and oncology, so cancer and blood. Like separately, there's a niche of a niche of a niche that you can work as a nurse. Isn't that crazy? There's so much variety out there for people if you're interested in nursing.
Yeah, I think something that I always say is my job is a specialty within a specialty. So like you said, there's pediatrics, there's little people, but there's also cancer and blood disorders, which in itself, it's almost like different rules apply in our area of nursing.
Yeah. I definitely know that. Like, we do things a little bit differently to you when it comes to policies and stuff. I remember you came home one time and you're like, oh, this nurse did this, does that. I'm like, what's wrong with that? It's totally fine. And of course not. You treat the kids differently when it comes to cancer and blood. You do things differently. So yeah, it's a very big world, actually. And that's one of the things I actually love about nursing, Nicole, is you can do so many different things. You can go so many different places, and all these hospitals have different types of care they need and different types of nursing. And you can't really be bored. I don't think you can be bored as a nurse because you can move so many different places. Yeah.
So now that we've spoken about ourselves individually, why don't we give everyone a little bit of information on who we are as a couple? Our podcast is called Nursing a Couple. So are we a couple?
Yes.
What are we?
Yes, we are. We're a couple. We're a married couple. Freshly married just since last November of 2024. So I don't know when you're listening to this, but yes, it's been a couple months now. Yeah, but let's start from the beginning, right? We met at uni. Back in Sydney, if I can say that. And I had this weird way of trying to get to know Nicole.
Oh my goodness, I'd almost forgotten about that.
We were on a group assignment, and yeah, she just caught my eye.
So we met at uni. You asked me out on the very last day of classes, leaving it absolutely to the last minute.
Well, you know what they say, leave the best for last, right?
Yeah, I don't know, 10 years? It's been a long time. We've been through start of our careers together. It's been
a decade of nursing together, and that's something we'll talk about in future episodes later, is about actually being a couple nurses, navigating night shift, navigating time, commitments, rotating shifts. There's a lot that we want to talk about to anyone that's interested in listening there. So yeah, we'll save that for another time. But of course, if you have specific topics you want us to talk about, you let us know. We're very open, and we're more than happy to indulge. So we've talked about a little bit about ourselves. Let's talk about what we think or what we want this podcast to be. Now, if you're listening to us, this is our first ever episode. We're doing this a little bit nervously, but I want to try and explain why we're doing this podcast. So from my point of view, we're two nurses. We've been nursing a decade. We've got a lot of experience and a lot of really unique experiences that I think people are interested in hearing. It's very rare that you get to see the point of view of someone's unfiltered, which is the tagline we're going with, and just, letting you know what it's really like on the field. We have a range of topics that I really want to get to, what is a nurse, the work-life balance, self-care, different types of pathways in nursing, Grey's Anatomy, all the TV shows, are they actually real? All this sort of stuff I feel like I want to get off my chest. And I didn't know of a better way to do it than starting a podcast with my beloved wife. So, my beloved wife, what do you think the podcast should be, or is, or what are we doing?
I think we're aiming for informative, conversational, very opinionated, and a little bit of lifestyle thrown in there, I think. Like we said before, nursing is so broad, but so is the space surrounding it. There's so much that we can talk about. There's so many aspects of our life that it touches on. Like I said, I try not to make it my whole personality, but it's very
ingrained.
Yeah.
Like two nurses, our whole life is about nursing.
And we definitely get to see a side of the world that not everyone is privileged enough to experience.
That's right. We also get to see the things that people shove up their butts in the x-rays.
Sometimes. Yes. You more so than me.
That's right, yes. And I'm very excited to share those stories with you guys. So my friends, we've talked a lot about ourselves. We've talked about nursing just a little bit. So we just want to say thank you for listening to our first ever Nursing a Couple podcast. We really look forward to hearing from you guys, any questions you have, insights, even nursing stories if you want to share.
We love stories.
Yeah. If you see anything on Reddit or social media, just send it to us. What's our email, babe? Do you remember our email? It's nursingac@proton. Cool stories, send them our way, and we'll be able to talk to you guys about it. So yeah, thanks for listening to our first ever episode of Nursing a Couple.
Join us next week where we'll be talking about what is a nurse? What really is nursing? What does it mean in this day and age?
Is it like Grey's Anatomy?
Oh my gosh, no.
Or Scrubs?
Oh my word.
Or The Good Doctor?
Scrubs, maybe.
Scrubs is good. I love Scrubs.
Maybe. Yeah. Anyway.
House is the
most unbelievable.
Oh geez, yeah.
No, absolutely not. Anyway, guys, we will chat about all this next week.
See you guys.
See you next shift.
See you next shift.